So without any further ado, let's kickstart the show. And joining me is Harshvardhan Roongta to talk about this topic. Harsh, thank you for joining us today on The Money Show. Healthcare workers have especially found themselves in a very dangerous situation with this pandemic really gripping the world. But they've put themselves in the forefront, so that our lives hopefully become a little easier, a little better. We're hoping for a vaccine as well very, very soon, which will take the burden from them. But until then, of course, every day we have close to 80,000 new COVID cases being added. One way of course, helping them is simply by not stepping out, by taking care of yourself so that the load is not put on them. And then the second way, of course, is ensuring that their financial future is secure, that they are making the proper investments. They are working so hard, they're earning this money. So I hope they're making proper use of their money. But let's start off with that. Harsh, one thing that's peculiar about healthcare workers is that they are exposed to a series of, risks to their lives. Do you think that is a key reason why their investment strategy should be different from, other non-healthcare workers like you and me?
Mobin, I'm glad you brought up this topic today. And through this, The Money Show, I think we can all, express our gratitude to all the health workers over there. I mean, it's not really easy while we are staying at home and trying to be, safe and secure, taking care of ourselves. These are these people who are not actually staying at home and stepping out to take care of the people who are fallen ill. So, our sincere gratitude to all the health workers. And now coming to your question about how an investment strategy would be different for a health worker as compared to other people. So, with regards to specifically investments, the portfolio will not have anything different per se. Whenever you choose which asset to invest into, I mean, it's primarily dependent upon what are your goals, when do you want it eventually, what is the risk profile that you can take. So, the portfolio construction would essentially entail those parameters. So that we're not going to deviate from. But as you rightly said, I mean, the risk on their lives currently is very high. So either there could be a situation wherein they can, contract this contagious disease and fall ill themselves, or there could be a death. So in that case, what is paramount right now is definitely that you need to take care that you have an adequate insurance portfolio in place. So income and investing would be one part. Taking care of contingencies like falling ill yourself, or if unfortunately a person passes away. Now in that case, just ensure that you have adequate life cover in the form of a term plan, and you have adequate Mediclaim policy. So in case you were yourself to fall sick, just ensure that you get the treatment that you deserve, and don't fall short of money, at least in that context. So I guess insurance is something which needs a very, very deep look at this point in time.
Exactly. Insurance is something that's very, very important, especially for all of our COVID warriors. Now, health and, a basic life insurance, I'm sure, is very important. Harsh, do you recommend that, their life cover, their sum assured, that bit of, their overall financial portfolio should be more high, they should not cut corners over there that, okay, I do not want to pay so much premium, so, let me just cut down my sum assured. Do you think that bit, is absolutely uncompromisable?
Absolutely right. So in fact, if you look into investment portfolios and the insurance portfolios of many individuals, I mean, you will notice that, insurance is such a topic that, people generally tend to stay away from it because they're so heckled already by people who are their relatives as agents and all that. I mean, so people usually prefer that, they don't like the subject of insurance. So if you talk to somebody and say that do you have adequate insurance, the answer comes out, yes, I have lots of insurance. You say, how much insurance do you have? So the question then answer comes is, I have 10 policies. You still have to ask how much insurance do you have. So they say, I am paying an X amount, say 1 lakh or 2 lakh of rupees every year. The question is still not answered, how much insurance do you have? So the sum insured is actually what you need to look at. And in most cases, you will find that sum insured will not be adequate. So yes, answering that question, you will need to ensure that you do not cut corners with respect to insurance, be it life or be it health. I'll tell you another reason why. Being professionals, the source of income is when they render their professional service. It's a skilled labor. You can't visit a doctor's clinic when the doctor is not available. So if you are a doctor, there is a patient coming in to consult you. Now, if you are not going to be there, the income stops completely. You may have support staff, you may have compounders, you may have other people in your office, in your clinic, but nobody comes to consult them. So the clinic's income will stop completely in case you're not there. If the clinic income stops, your family income stops. So insurance for professionals is very, very essential, and you need to insure yourself to the maximum amount that you're eligible for. In case of life insurance, there is a maximum that you can get is a multiple of your income. So if you're earning an X income every year, based on your age, you will be eligible for an insurance which is 10, 15, 20 or 25 times of your income. So ensure that you take the maximum insurance that is eligible for. With regards to health insurance, you know the cost of medical treatment these days. I mean, you're a healthcare professional yourself. So you must insure yourself for a higher amount, and just ensure that the worst case scenario, you at least have 20 to 25 lakhs available in the form of an insurance per annum at least. So health insurance would be at least say 20 to 25 if you are in metros. If you are in smaller cities, of course you can buy an insurance for a lesser amount, but more the better.
The higher the insurance, the better. And yes, don't compromise on that bit, especially if you're a healthcare worker. It's extremely, extremely important, and especially if you're a healthcare worker, like I mentioned. Okay. Harsh, the specialized nature of their work is that unfortunately they are dealing with risks, and because of this pandemic, we're also looking at them dealing at risk to their lives as well, right, on a daily basis, especially for those who are till date actively fighting COVID cases, making themselves available to patients, to cure them, to treat them, whether they are nurses, they are doctors, so on and so forth. Is there a special feature in their investment portfolio which you think should be a part, for example, say maybe a higher liquidity component, or perhaps more cash in their portfolio because of this, threat to life? Even if, let's say, they have health insurance in place and life insurance in place for their own treatment and for the future of their heirs and their successors, do you think this should be a feature?
Yes, Mobina. As I mentioned, the peculiar nature of their profession is until they are earning and contributing, you will find that income is stable. In case this person, the healthcare individual himself or herself, has to fall sick, for instance, as I said, income stops. So there is a great need for an emergency fund. I mean, which is required for every individual, but for professionals for sure. Salaries could stop. I mean, if you're a consulting doctor, you're not consulting, there is no income. It's not that you're on a rolls of a hospital that will give you salary for that matter. So in that context, just ensure that emergency funds are adequate. Now, in formal sector employees, we say about 3 months of your expenses that you keep as emergency fund and liquid fund. I think that's good enough. But in these cases, I would suggest go further to have an emergency fund to the extent of 6 months. So that even if you are yourself not going to be able to generate an income, you have enough money lying, in an emergency liquid fund kind of a thing. It could be a bank FD linked to your savings account. It could be a liquid fund for that matter. Just ensure that the money is available to you. In case you do not have insurance, so this was the first case I spoke about. When you have sufficient insurance, still you need to have 6 months. In case you do not have insurance, then the requirement for an emergency fund goes from 6 months to actually 1 to 2 years for that matter. Now, why do I give a reference to this? We have many times we have doctors and all these professionals as our clients. We realize that they're very senior in age. Getting an insurance becomes a little difficult, and because of age factors and all that bit. So in that case, then you have to create a contingency fund for yourself. So in case you do not have sufficient insurance, then make sure you have a contingency fund for 1 to 2 years. So this is one peculiar situation with this particular profession that we're talking about, and this needs to be taken care of.
Okay, so that's with respect to that component. Harsh, you mentioned right at the beginning that as such, there is nothing very peculiar as such in terms of an investment strategy for for these healthcare workers. So I just want to understand when it comes to the whole equity debt bit, is there something very substantial that you would change over there, or again the basic principle would remain the same as it would for non-healthcare workers?
Mobita, when you're talking about creating an investment portfolio, the inputs, ingredients of creating an investment portfolio essentially is what is your risk profile to start with? What are your timelines for a goal? So suppose you have something which is say 10 or 15 years away from now, then the investment product will be accordingly designed. If you have something which is about 2 years hence from now, then there will be another investment product altogether. So your goals, risk profiles, that essentially decides your investment allocation, whether it is debt and equity. So that bit does not change for any individual, be it professional or be it any salaried individual for that matter. So I would suggest don't go into allocating more towards debt just because you feel that I may not have continuity of income. You need to make that good by having adequate insurance for that matter. So investment portfolio does not change. The nitty-gritties, the ingredients of creating a portfolio do not change. That is dependent on your goals, your risk profile and all other such parameters. Nothing to do with COVID for that matter.
Okay, so nothing to do with COVID or anything for that matter. You need to take need to look at your own risk parameters among other things, and essentially then decide how you want to go about with your investment. But all in all, the strategy, like we always discuss on the Money Show, essentially remains the same. Or simply put, depending on your financial goals, you do your investments in debt and equity. Debt for the more shorter term goals, and equity for the more longer term goals. If it's retirement, just 100 minus age, and that should essentially help you out if you don't find yourself very financially savvy. Okay, let's talk then, Harsh, about how exactly you recommend, and I would like to say this especially for all of our newly inducted healthcare workers. They as well want to go about making their investments, and they've heard you out on the importance of insurance. But of course, one key feature for our newly inducted healthcare workers is that firstly, their expenses relatively may be low, but even their incomes are quite low, and then you have to ask them to invest. So you can find themselves in quite a tricky position. So do you recommend that they maybe start off with smaller amounts when it comes to investing, like you mentioned in your previous answer, in equity, debt and other investment vehicles, and then slowly keep amping it up?
You're right, Mubina. In fact, when you start investing, you don't really need to have a lot of money to start investing. Even if you're earning since you're a young professional, you just got into work, and medical profession is such that until you have adequate experience, you don't really start making money, and that adequate experience comes only after the age of 35, 40 and above. So, when you start off, even if you have less income, do not worry about the quantum that you're investing. Be focused on the fact that you're actually forming a good habit of investing. So, even if it's 1,000 rupees a month, you should make it a point to start investing money. You can really be acquainted with these investments, and then you can just simply top up your money, top up the amount that you're investing. But you also need to understand, not investing anything is a big disaster. Even small amounts of money can become a large corpus over a period of time. So, I don't think at this juncture you should really worry about the quantum that you're earning. Worst case scenario, start with a 500 or 1,000 rupees a month. And that I believe every individual can do if he or she really wishes to do that. So, a very strong point to you is you have time to your side. If you're a young professional, don't miss out on this time. And the power of compounding is really in your favor. So invest as little as you want, but do make a beginning. Do take a start in this direction.
Harsh, any note on emergency funds? We usually say that a certain percentage of your monthly income should be set aside as an emergency fund. Should that be any different, for healthcare workers? For example, 6x of your essential expenses should be in your emergency fund. Do you think that amount should be higher perhaps for healthcare workers, or again, the same principle could apply?
No, so for a healthcare professional, when the source of income is your own contribution. So if you are not there, the income stops completely. That's very peculiar a situation with a professional. If it's a business environment, for example, even if the owner of the business or the CEO or the MD or the founder of the business is not there around, the other staff members can run the business for at least some time. In the case of a professional, a doctor or lawyer for that matter, if he or she is not giving in the service, the business stops completely. So contingency fund, emergency fund requirements are really large and so ideally you would say 3 months of expenses, in this case at least 6 months, in case you have sufficient insurance. If you do not have sufficient insurance, then we've already said you need to extend this to say probably 1 or 2 years. Now with young professionals as well, I mean, you need to have emergency fund because emergency strike anybody. It may not be a young person or an older one. Now, how much should you set aside? Well, if you're saying I want 3 months or 6 months of my expenses to be available, you will need to allocate more until you have accumulated that much corpus. Once your corpus is accumulated, then of course you can start reducing the need for contribution towards emergency fund, but you can then redirect that money into other goals. But until you have formed that emergency fund, you'll have to allocate a larger portion of your monthly savings towards emergency fund, and probably it's like an EMI. When you start paying your EMI, initially the EMI, the interest component on your EMI is very high and the principal is lower, and that keeps reducing gradually. So is the case with an emergency fund.
All right. Okay, so there you have it. That's of course, with respect to everything to do with financial planning for a healthcare worker. We see you, we acknowledge you, and of course, we on the Money Show would also like to help you by guiding you when it comes to your financial future. So calling out to all the healthcare workers, if you're watching the program, please do send in your questions and queries regarding your financials. And we will have, of course, Harshvardhan Roongta. It'll be a pleasure to help you out with your portfolio, even if it's for retirement, even if it's for something to leave behind for your heirs. You can always write into us. All right, well, let's now take on board some questions and queries that we've received, and let's take on board the first question. We have Dr. S. Pichai who writes into us saying that I've invested 5 lakh rupees. I think this is a lump sum he's invested in December 2018 in the HDFC Balanced Advantage Fund, and he invested in this for the long term. So he's saying for 5 years. So he used it as a long-term saving. As the financial advisor, advised to invest in balanced fund as it is for the long term, for example 5-year period. Now he is saying before retirement age. So I'm assuming that Dr. Pichai is nearing retirement. He's probably 5 to 6 years away from retirement. Now what he's perturbed about is it safe to hold or shift to other balanced advantage funds, because HDFC fund has lost quite a bit, whereas the erosion of NAV is very minimum in other funds. So that's his question. He's basically wanting to say, I think, only in balanced funds, but he's just a little worried about which AMC should he stay with, whether it's HDFC, maybe an ICICI or Edelweiss. So he's approaching retirement. Unfortunately, Dr. Pichai has not really told us where else has he invested his money. But let's assume maybe that he's just put this 5 lakh rupees over here. I'm assuming he's got other sources of income as well. Harsh, what would you recommend Dr. Pichai, particularly for the HDFC Balanced Advantage Fund? And let's assume if this is the only investment he has, where do you recommend he diversify, given the fact that he's got only another 4 or 5 years to go for retirement?
The concerns that Dr. Pichai has put up is primarily to do with the performance of HDFC Balanced Advantage Fund. So, as far as the category goes, so I can say, Dr. Pichai, that the Balanced Advantage Fund or Dynamic Asset Allocation Plan, as these categories are, I mean, these are designed in such a way that the equity allocation in these schemes are keep varying based on a predefined matrix, and that matrix basically works considering the market level. So in that context, the asset that you invested into, the scheme that you invested into, with the lump sum amount, it's fine. So there's no really a problem in the category of the scheme that you invested into. You're right when you say that HDFC Balanced Advantage Fund, the performance hasn't been good. Well, HDFC is a fund house. All their equity schemes have kind of, not done very well in the recent past. However, they have a very good fund management team. So I wouldn't write them off or give up on them as of now. I mean, we won't really give up on them for completely. What I can suggest you can do is 50% of the amount that you've invested, so that's probably 2.5 lakhs. You can switch into another balanced advantage fund. You identified ICICI through balanced advantage fund, so you can move 50% of your investments currently in HDFC to ICICI. In this way, you'll also get a diversification at the fund house level. You'll get the expertise of another fund manager as well. And probably 6 months from now, you take a look again at HDFC Balanced Advantage Fund for the balance amount that is lying there, and then take a decision. If it has recovered, fine. If it's not, then probably you can move that other 50% out as well. I think going further, this could be the strategy that you can adopt, and take exposure into another fund house as well. split the money so that you get the benefits of both the fund house and the fund management scheme.
Okay. Well, we've got lots of questions and queries lined up, but Harsh, I'd request you to stay on. We've just got some breaking news coming in. The Indian government has now banned PUBG and 118 other mobile applications. This comes in